So why don't we start by just quick introductions? I think most of you know each other, but why don't we just quickly say who you are, where you work, and how you got involved in safety too. I think that's a useful insight. So maybe we'll start with you, Keith.
Hi, Keith Bird. I am the Internal Operations Manager for R&F Ventures, general contractor in Prince Albert. My background really isn't in safety, but I got into safety in 2012, something sort of totally different as a career change. My background is actually in small business and retail, but I found that there's lots of things about safety, especially around the sales end of it, that really fit in easy after working in a retail environment for many years.
Great, thanks, Keith. Dana?
I'm Dana Paidel. I am with Icon Construction, and we're mainly an industrial contractor. I got involved with this conversation a little ways back. I also sit on the SCSA board of directors for the last number of years. I've been doing steel fabrication and construction all my life, ever since I was a little child. I kind of grew up in the construction industry.
Yeah, and Keith, you're on the SCSA board too, right?
Yes, I am.
And I think Ryan is too. And actually all of our speakers, I think that we have are either work for the SCSA or work with the SCSA or work on the board. So that's fantastic. Ryan, can we hear from you next?
Yeah, my name's Ryan Smotra. I'm the Regional Safety Manager for Graham Construction. I've been involved in safety or in construction over 20 years and safety on a full-time basis for about 15 to 18 years of that, depending. So, been my career for a long time.
Fantastic. Loy?
I'm Loy Levesque. I'm the Advisory Services Manager at the SCSA. I've been with them coming up 9 years. And prior to this, I built a safety program for my husband's company. And that kind of fed into, I loved it, loved being on site, helping people out. And finally, it came to a point where I did not want to work for my husband anymore. So I went to the SCSA.
That's awesome. Thanks, Loy. Ray.
Okay, Ray Anthony. I'm the Executive Director of Occupational Health and Safety in the Ministry of Labor Relations Workplace Safety for the province of Saskatchewan. Our mandate is to regulate the provincially regulated people, those that are under federal jurisdiction. I had 28 years in construction. I'm a journeyman electrician by trade. Before I came to government, I've got about 20 years in government in the ministry in health and safety. I'm a registered safety professional. And as a back comment, I'll say that at one point in time, I sat on the board of directors of the SCSA and the Saskatchewan Home Builders Association.
There you go. So it really is a tight loop. I think that's a good sign. So I don't have a plan for where I want to start this conversation, but I'm going to start it with this question. In your mind, what has been the most significant impact on site from COVID-19 so far? And whoever wants to start can start, and I'd like to hear from everybody and your thoughts on this.
I think one thing for us has been it's been a positive, has been the quick uptake of new procedures, new processes, very quick understanding by our workers on site of the importance of this particular, the safety things we've had to bring into effect. And I don't know if it's because of the, we always tell our guys that, you're working in a dangerous environment, but I think COVID has brought sort of a new level of awareness to safety, and we found it really easy for our guys. They didn't balk. Sometimes you bring in a process or a procedure, and they kind of roll their eyes and look at you like, really. In this case, it was really an easy easy transition to what we had to do, and which is a great positive. And I think that's just because of the way the industry is in general. Our guys are used to working around procedures and processes, and the uptake was really quick and positive.
But from your perspective, maybe it did drive a greater awareness, so that it was, there wasn't maybe, and I'm putting words in your mouth, so tell me if I'm wrong, but there wasn't maybe the same kind of resistance or skepticism that you might otherwise see with new procedures.
Exactly, and it might have to do with the consequence, I guess. You know, we always tell our guys that you know, you're working in a dangerous environment and these things could happen, but when one of the consequences could be death, it seemed to open their eyes a lot quicker and make them pay attention. Not that we have a problem with that necessarily, but it was certainly a quick uptake, and they were looking for ways to keep working, which was good.
Interesting. Dana, did you want to add something to that and give your perspective? Thanks, Keith.
Yeah, playing off of Keith, the employees really took to the procedures very, very well. One of the things that we found within our safety system, that we actually had gaps when it come to the pandemic plan overall. Like, we've planned for everything from high rescue or high angle rescue down to the fall protection requirements on a job site, but we've never planned for something like a pandemic. So we ran into that issue, but once the information was available and we put a plan together in, I think, about 3 days, we had the plan up and running already on some of our job sites. The one issue that we did have was being able to get the equipment from our rental guys over to us. So overall, the pandemic plan worked, but it was not being prepared for a pandemic of this nature. Like, we're prepared for fires, we're prepared for earthquakes, we're prepared for tornadoes, but no one ever thought that we would have a pandemic, a COVID-19 situation that came through our province the way it did.
And next we have to be prepared for murder hornets. So I don't know what the prep is for that one, but so let me ask you, Dana, then, like, what was the hardest part from your perspective and from a safety perspective in terms of gearing up for something that you weren't prepared for?
The hardest part was getting the communication from the World Health Organization, Saskatchewan Health Authority, and keeping it flowing to the job site fast enough. Because every day we would have somebody come out and say another thing, and then we would continue adding on. So every morning there was toolbox talks, and then we were bringing in thermometers to check temperatures and that type of situation. So it was the communication from, you know, your media sources, the health organizations. Saskatchewan Health was the one that we went back to on a regular basis and updated and checked it about every 3 hours, making sure we had the latest information and pass it along to the site. Is really what it was.
So the changing information and being able to stay on top of that and communicate it out effectively.
And no one out there really had a lot to do with this type of pandemic. Like, talking to some healthcare professionals I know, and a nurse that lives across the street from me, and they weren't really prepared for something like this either. Like, they have procedures, but nothing that actually happened, like what went through. So
yeah, there's a difference between an exercise on paper and actually living it out on a day-to-day basis for 90 days, right, or more.
And like I said earlier, that's where we found major gaps when it comes to this type of situation. It was so we've got that filled in, and now we're hoping we don't have to relive this in the fall or run through of COVID-19, a mutated virus in the fall. But
well, we're going to talk about that, because I think we are going to be dealing with some of this stuff for a while. But Loy, I want to come to you first. Thanks, Dana, on that. I want to come back to the original question, which was from, I mean, you interact with employers all the time across the construction spectrum. Your team does. What are you guys hearing? What are you seeing in terms of what has been the biggest change in the industry when it comes to safety as a result of COVID?
First, go ahead.
Oh, go ahead, Loy.
I would say the biggest thing has been no one had pandemic response plans in place. Sorry, not no one. Many of the small, like home builders, they didn't have a plan in place for this. They knew the legislation was there. They may have, you know, skimmed over it at some point, but not enough had been done to have those plans in place, even with some larger companies. So very reactive at the beginning of this, just trying to scramble and put something together to keep working. And a lot of fear at the beginning with workers. Am I even safe to go to work? So it was definitely a scramble at the beginning of this to get those resources and help those companies so they could continue to work.
And what do you think the hardest part has been for companies so far?
Hardest part?
Yeah.
Financial implications, absolutely.
Yeah.
With the carpooling, with the shared hotel rooms, that sort of thing, with the inability to get their hands on the personal protective equipment they needed to do their job, that it's been a struggle.
Okay, thank you. Ryan, you had wanted to talk a little bit about some of the biggest changes that you've seen so far on site for your guys. Do you want to talk a little bit about that?
Well, I was just going to mention one of the biggest things that's changed is how we schedule work, because you now have to do work in such a manner that you're trying to keep workers from being close to each other, and how you're scheduling, how you're phasing work, and you know, how you're controlling the field, you know, the workers in the field has had a significant change. You know, it's a lot more detailed than it was before. And I think out of this too, that there'll be a positive that comes from that as well, because, you know, you're more closely managing what's happening.
So do you have to spend more time there? I guess you would have to spend more time in the planning phase of the project to figure those things out. And are you doing that, like, are your teams going to have to do that now even before you bid, right? Because it obviously affects pricing and it affects scheduling. So are you now integrating those kinds of considerations
Absolutely.
earlier? Yeah. Okay.
Have
you seen that already?
It's happening already, and it's been going on for quite a while. But it's when you're doing it, there's ways, you know, there's obviously going to be cost implications of it, but there's also ways to find efficiencies while doing it. So, you know, as much as there's difficulty in it, there's opportunity in it as well.
Okay, excellent. What's been the hardest part, Ryan?
To be honest with you, I think the most difficult part has been trying to keep up with the questions, because, you know, especially at the beginning, you know, we're at a point now where there's a lot of that's filtered its way through and is done, and we've been able to get answers. But at the beginning, you know, we were getting questions from workers and stuff, you know, live time, and we don't have the answers immediately. We have to go through health, you know, Sask Health and get the information, making sure that we're getting correct answers. So, you know, going even from the what ifs to what can we do, that was the most difficult part, I think, trying to give proper answers.
And Keith, thank you for that. And Keith, I didn't really ask you that question about the hardest part, but I mean, Dana and Ryan have sort of hit on a theme here of the information, right? And trying to stay on top of information when you might get different information from one source than the other, and it's changing. And I think that's slowed a little bit, or it's improved a little bit, maybe the better way to say it. But what's your perspective of what the hardest part has been managing through the pandemic so far?
Yeah, for sure. The information management and deciding where you were going to, what you were going to edit and where you were going to get that information from. Something we sort of did early on was, because there was so much coming at you, you kind of had to decide what you were going to use, who you were going to listen to. And once you figured that out, I think it wasn't that bad. One of the things that wasn't necessarily for us managing it, but one of the things I've noticed with our guys in the field, that has been probably the most difficult thing for them to adapt to, has been, when you talk about scheduling, things like lunches and coffee breaks. You know, we spend a lot of time in a small company building your team and camaraderie amongst your team. and now you implement, you know, splitting coffee breaks or having coffee breaks in separate locations, lunch breaks, those things, lunch areas. That's the feedback I've been getting from some of my guys in the field. Like, that's the question that they ask, can we have lunch together again? You know, which it's a good thing. It's a good problem to have, because obviously there is a feeling of team and camaraderie there, but it's something we didn't really think of. But you know, it happens on site, but they're still managing it the way they're supposed to. But it's certainly a question I still get. And you know, can we ride in the truck together out to Melfort? No. You know, those types of things.
Yeah, I've heard that. I've heard guys express to me the sense of loneliness even on site, right? Because they have to stay isolated from their colleagues and their friends, and so it just doesn't feel the same. I think that's true for all of us, but it's not the kind of thing I would have expected to hear either. So that's interesting. So Ray, what's it been like for your guys? I mean, it's a different world for everybody. It's a different world for your inspectors and others too. How are they finding this, and what's been the biggest challenge for your team, and what are they seeing on site?
Well, I think you guys have touched on a number of things. The first one was the information. Most of this is being driven by the Chief Public Health Officer. And of course, his orders are very broad. They cover multiple different types of employment, or well, actually, public endeavors as well, right? And so we've been left going back to them a great deal, trying to interpret what they mean, which takes time, which is not quick. That's the first part. The second part is we have a number of people that have been deployed. They're actually deployed to other ministries, and they're working up north right now on traffic control and other things, trying to keep the LaLoche outbreak bottled up. But beyond that, they work fairly well alone. We have about 65 field staff, and they all do work pretty much independently. So that, like, they were set up to do that, and they didn't have any difficulty in doing that. It has been rough. We've had a number of vacancies. We want to get people hired and trained into those vacancies, but without the ability to be one-on-one, you know, I guess you could argue or say that our system is very much like it's sort of de facto apprenticeships type system. It's been almost impossible to do that, and I imagine it'll be difficult for construction trades as well. The other thing that's interesting is when you talk about these meetings. Our guys were used to having the Monday meeting. They promoted consistency, they promoted camaraderie and that. And now again, they're doing it via Skype or Zoom or whatever. Again, it's the same, but not quite the same. That social side of it is really important to them. You can see that it does affect them quite a bit. And so that's been difficult for us. But beyond that, we've done some inspections with public health to give them a hand. Probably the most public one is out at the refinery during the strike here. But we've done a couple more. We've got to drive on in the meat packing plants and those sorts of things to go through those right now because of what's happened in Alberta. Other than that, it is pretty much business as usual, although everything's a little bit harder because you can't meet.
So I want to follow, I want that point that Ray and Keith have made about the camaraderie. I want to come back to that in a second, and I want to ask all of you in a moment about your perspectives on how you lead teams in a time like this, right? To help foster those things. Like, how do you maintain engagement when you have to be distant? And how you're finding that experience in terms of leading your teams. And so Ray, I'll ask you that. Before I do, I want to ask you a specific question about construction, Ray. So you guys are continuing, of course, to do your site visits and things like that. And you know, if the public calls in with complaints and things like that, you're following up. I know I did one of those with a residential roofing site that I had some concerns about, and your guys were out there that day and looking at it. I'm curious about, like, has your volume of calls significantly increased? Have people been, like, have you seen, I'm going to use the term, like the COVID bump, where there's been a lot more calls and concerns about construction? And what have your guys been finding on site, and has that changed over the course of the pandemic?
We're used to having bumps and jumps and different things like, as you can well imagine, when we had the big forest fires here a few years ago, the number of air quality calls and whatnot from up north just escalated something awful. The one thing that has increased is the number of work refusals. I think right now in the last 60 days, we've had 10. That's normally what we would see in a year. They're all in various stages of being handled, but the thing that's really unusual is that typically work refusals are around a task that a person hasn't been trained or equipped to do. They're not around showing up for work. And in this case, there's a real fear out there of simply going out in public. And, if you look at Regina, I think we've had one case since the first. So one positive case in the last 14 days. So, just on sheer odds, it's 1 out of about 200,000 that you would run into somebody that actually is infected. Now, not to say that you shouldn't, for that, and a number of reasons, take precautions. It shows the amount of fear that's actually been generated out there. And to the other comment, I can't remember who made it here, but the willingness of workers to adopt new processes and that's why, is because this thing's kind of invisible, it's deadly, and because, you think of it, they're burying about 100 a day in Quebec. It scares them. And so it's literally frightened people into going out of their own homes.
So those 10, just out of curiosity, those 10 work refusals, are those all in construction?
No.
Yeah.
Transportation, healthcare,
right.
All over the spread. You name it.
Yeah, that's interesting. Yeah, and I think you're right about that it's fear is a big driver, and that understandably, it scares me too. So I get it. And I'm fortunate enough to be able to work from my home, right? And do my job in an environment where I can control a lot of those things. So I'm lucky that way. Ryan, maybe why don't we start with you if you're comfortable on the question of leadership. And, this isn't specifically a safety question, but it's more a question around how you help teams and how your company is helping teams navigate through this uncertainty, and how you help them find ways to maintain that camaraderie when, they can't sit in the truck together and they can't have lunch together. They can't do those things that they normally do.
Well, it's been difficult. When you can't have those, that close relationship, even out in the sites where, you're separating times, you're separating break times, you're separating shift times. It's been a struggle. A lot of it has just been, allowing the guys to get their jobs, do their work, and Zoom meetings, that sort of stuff has been the only option. It's probably the biggest struggle right now. You can't let them all get together. Even, things like orientations. We've been doing had to come up with ways of doing orientations online, get training online, all that sort of stuff, where people are a lot more used to getting together and even you get questions answered and you get a read off people if they understand things. Yeah. It's been a struggle, so, what have we been able to do to bring that back? Not much. It's you can't right now, and that's currently the biggest issue. We're looking forward to being able to open up a little bit and having some barbecues on site and that sort of stuff where you can get the guys in a situation where you get them all fed or whatever and bring them together, but without having them close together. The warm weather is helping out quite a bit. Being able to congregate a little bit, around a site or around area, just being around groups, but keeping people separated, making that possible, be outside, talk to groups of people and keeping them spread out has been, has helped out quite a bit, but it's not something that we've been able to do much about. It's part of the process right now.
Yeah, and it's interesting because it does have an impact on morale, right? And I think there's other factors like you talked about being able to open up and have some barbecues. I think nicer weather helps, all those kinds of things. But the longer this goes on, and we're going to talk about that in a while, the harder it's going to be. So Loy, can you talk from the SCSA perspective? I mean, you got team all across the province, right? And the SCSA is a big crew, but all, I think, mostly working from home and all of those kinds of things. So what are you seeing in terms of how to keep teams together, even in a time when they can't be?
Actually, I'd have to say for the most part, our team is functioning very well in this area. We're doing a lot of Zoom meetings and team meetings. We have an ongoing advisor group and everyone's contributing there. We have beginning and end of the day huddles. Quite often it's just to check in, how you guys doing? How are the kids today? Because that's a whole nother challenge that people are dealing with, trying to work from home. So trying to manage that, but they've been wonderful. I would say the biggest challenge has been managing their own, they aren't accomplishing as much as they would in the office for some of them. You have children at home, I get that. So things are going to adjust. If you need to work a little in the evening because you're busy with the kids in the day, you know, I'm fine with that. We work it out. But as a team, just staying in constant communication with each other has really helped.
It's interesting. Yeah, actually, that's something we'll come back and revisit, is the productivity at work, right? And when your life is filled with so many more things than it was before, even if you're not working from home, if your kids are home full days, if you have kids, right, that creates other pressures at home. So yeah, it's a really good point that we should circle back to. Dana, what about you and your crews in terms of keeping people engaged with each other and keeping that camaraderie going? How are you finding that? What's working for you?
Well, nothing's really changed on that aspect for us because most of our job sites are 2.5 to 5 hours away anyway. So the working on the job sites, they were usually smaller crews down in Estevan or up north or out east or out even into Alberta. We did a lot of one-on-one phone calls back and forth to everybody. We spend probably 8-9 hours a day just having conversations on different projects, what everybody's feeling about them. And then we'd go into some social aspects of things. How are you guys making out with your home life? It's warmed up now. You guys are probably getting out. They're heading for walks. They're spending a little bit of more time with their wives now. You're able to get outside and do some yard work. So people are starting to feel a little bit better for our job sites. It's more of a concern for the people that are working from home right now for me, because there's a lot of mental health issues that could come out after this is over. I see a lot of social change probably going to happen, and people are used to having conversations across the fence with their neighbors, and that's what actually is our next step that we were looking at, is the mental health aspect of things, because it's when you're isolated off into your own lunchroom or you're splitting shifts, you don't get that conversation going back and forth, wanting to make people, you know, closer at night, close-knit family thing, right? So you're starting to see people starting to wear down a little bit, and they're getting tired of it, because, you know, you can't even go visit your father. You have to stand across the road and yell at them and stuff like that. And we're not used to doing that in our family anyway. So we're a very social family.
Yeah.
So that's the issue that I see right now on my job sites, is some of the people are becoming lonely. Like, you're isolated off into your house for 2 months. Basically, I've been working from home for that 2 months, and I don't make my trips to the sites in Regina and Estevan and out to Calgary like I used to, and it becomes harder and harder. And
yeah,
now I'm used to working at home, and I don't want to leave working from home, because it's nice working with the kids.
Yeah. But it is wearing, right? I mean,
Yeah, it is.
Yeah.
It's hard. It's tiring because you wake up at 6 in the morning, you need something to do. Yeah, okay, I'll go do a little bit of here, and then 10 o'clock at night, I can't sleep. I'm gonna go down and look at my emails, and then you're there for another 2 hours. So
yeah, the day creeps, definitely.
yeah, it does.
Yeah.
It does. But the mental health issue for my job sites is what's concerning right now.
Yeah, I definitely want to talk about that too. So we got a couple of themes emerging here that we're going to circle back to. So Keith, you started off this conversation talking about the camaraderie and the challenge that some of your guys are facing there. How has RNF and what are you guys doing to help alleviate that or help lead through this time of challenge?
You know, we've just more communication. I think we touch base with two things. The line of communication, you know, often in a company like ours is from the office to the site supervisor, and from the site supervisor to the people that are working with him or her. And personally, what we've done with our company is more touch points with the actual employee. Maybe the guy that I wouldn't have texted or phoned or usually text or phone is the communication we use. Probably wouldn't have touched base with, you know, a particular laborer on site, but we've done that, and we've done more of it, and used email, phone, text, Zoom, whatever it takes, and then really being careful to, you know, the industry itself is, before this all started, was already in, wouldn't say a tailspin, but was already in a difficult spot.
Absolutely.
And you know, workers were certainly feeling that, our workers were feeling that, like, you know, the future was already uncertain, and now there's this. So we've been really, really careful to make sure that we can send out as many positive messages of hope, if you will. You know, things like your virtual town halls that the SCA does. You know, like the one yesterday that you guys did. You know, we normally wouldn't share that with everybody in the company, but I think they need to know that there's $181 million that's going to be out there, and that there is hope, and that there is going to be work out there. Mm-hmm. And I think that, so we've just increased the number of times that we touch base with these guys, and sometimes the touch is way more. It is more personal than it used to be. You know, right? Often it was about business, and now we're talking about how's the family, how are you doing. Things that we probably should have been doing better before this happened, but it's forced us and made us. I think it's made us better, because we continue to build a team, even though we can't go and shake a hand or put an arm around a guy and say, you know, it's going to be okay. Just having that constant communication and keeping the communication positive, and doing it at every level instead of just manager to manager or manager to supervisor to whoever happens to be working with them. So it's just been more volume of communication, I guess.
So that reaching out, and maybe reaching out in non-conventional ways, has allowed you to continue to connect with folks, and even when you can't connect in the ways we'd be used to, it's still allowing that touch point, which is really
it's elicited some really touching, heartwarming responses back, I guess. And sometimes when you're managing people, you kind of get away from the people part of it sometimes too much. And I've had emails and texts from guys and gals saying, you know, it's great to hear from you. You know, we had sent a guy wanted to go home at the start of this. He needed to go home, and you know, we didn't balk. And he sent an email that I'll probably frame in my office, talking about our company culture and what we did for him and his family. And so those are the positives that are coming out of this, and makes you feel good.
Yeah, and you know, I think one of the things that strikes me is something like this pandemic is something that reminds us how vulnerable we all are, right? And that we're all in this. We're all in this together, whether we want to be or not. We really are, and we need each other. And I know my own vulnerability and fear and concern and uncertainty. So I can appreciate that others have that, and I think it allows us to be more honest and engaging with us, because we all realize, you know, the future is unknown, right? So we got to embrace what we have, and yeah. So it's interesting to hear that. I think that's one of those, to your point, Keith, one of those positives that may may come out of all of this.
Well, and though your team always should have a common goal, everybody has a common goal right now, and it's all around COVID and surviving it and prospering after it. And it seemed that seems to have brought the team together in a bit, you know.
Yeah, interesting. Okay, so let's pick up on this is really continuing with this theme, but let's pick up on what Dana talked about with mental health, and maybe Loy, will start with you, not to put you on the spot, but that's always been something that I think we've all been aware of and concerned about, but certainly the awareness of it has been heightened when we're in something like a pandemic. What are you hearing and seeing from your team, or what are they hearing and seeing from the industry in terms of some of the things that people are struggling with and how they're coping?
Okay, within the SCSA, we've been focusing a lot on mental health and sending out webinars and LinkedIn learning courses. And last week was Mental Health Week. Everything's a blur for me right now. It was pretty recent. So we focused on a topic every day and sent communications out to the team and encouraging them to reach out and that sort of thing. My team talking to companies, though, there's a lot of concern about mental health out in industry right now for many of the reasons that we've already discussed, but the financial pressures, downsizing of companies, people unsure of their jobs, whether they're going to keep them, whether we're going to be able to keep things going long term. It's a lot of pressure for people to take in. So yes, as many topics on mental health or supports that we can get out there, I think that's an area we definitely need to focus on.
What are the kinds of major pressures you're hearing from people? I mean, you talked about the financial ones, and earlier you talked a little bit about some of just the home life challenges, right? And are those the main ones that you're hearing and seeing from people?
Yes, and just unsure about job security.
Yeah. Ray, how are your teams tackling some of these conversations about mental health, and what are you hearing in terms of across the industries out there about what they're facing?
We had a big push on mental health. We had the Not Myself Today. I don't know, whatever you want to call it, system or whatever in place for some time now, probably 2 years or so. We also, as a ministry, we're on a trial with the WorkSafe in the University of New Brunswick for their courses on mental health. Like, they have courses for managers and courses for staff and those sorts of things. And in addition to that, we have in place an EFAP for our for workers and their families and that. And I haven't talked to them recently to see how frequently within our unit and within government that's been utilized. But I know it is up. The fact of it is that for a lot of us, work is quite social. It's a large element of our lives. And that has been missing for probably better part of 90 days now, at least. And so that will begin to tell on people. You comment, you see more of your wife and that, and more of your kids. That can be both a good and a bad thing. If you're under stress because of financial issues, because of work deadlines, because of all those things, and your family can be viewed as a distraction, that's an additional pressure. By and large, we suffer the same things that I imagine is going through everybody that's in this. Like a good example, when we deployed some staff up north, the concern was of course for them, but that they would bring it back to the Saskatoon office or whatever. And the admin staff in the Saskatoon office, well, if they come back, now can we come back, kind of a deal? Are they going to isolate? Are they going to do all these things? And yeah, I mean, just out and out, there's a lot of fear. That's the bottom line of it. And of course, anything like that's going to really seriously affect your mental health.
Yeah. Ryan, let's talk about mental health and how your company is tackling that and what you're seeing.
Well, similar to what Anthony had mentioned there, we have talked to a lot of the guys and made sure there's information sent out to everybody and pamphlets given out on our employee assistance program. And even talking to the guys and through the toolbox meetings and just, conversations with guys, I think part of the difficulty that everybody's dealing with is that constant flux between wondering if you're underreacting or if you're overreacting, if you're taking the precautions you should be, or are you doing enough? Not only that, but, even the social aspect you were talking about where, typically you have friends all over site. Now you don't even want to go near people that you're used to, that you want to have a conversation with every day, that your coffee partner. Now, you want to have those relationships, but it's almost a kind of a fear of being able to go near them. So, you have to make sure you're giving guys the opportunity to communicate, give them chances to, use employee assistance programs, understand what support is out there for them, keep that conversation going. And the other part of it too is monitoring it, because families are under a lot more stress than they are right now. We're lucky in the construction industry that we've been able to continue working through this, but, a lot of guys have, husbands or wives at home that are unable to work right now. There's a loss of income. And then, like you said, the added stress of family being around all the time, or not only that, but also picking up the difficulty of being the teacher now for kids, and, especially if there's multiple kids, and trying to coordinate and arrange all that stuff. It's added a lot of stress on a lot of people's lives. And, just giving them the opportunity to know what services are available for them, and hopefully help them through, difficult spots when they come to them. But making sure that you can keep guys, keep the people in the field able to communicate with each other and provide them support when necessary, or with whatever you can.
Yeah, I mean, the reality is we all need help at times, right? And these are so weird times that it's, the ability to recognize that we're all facing challenges, we're all struggling with this, and that it's okay to need and want and ask for help, right? And yeah, I mean, I've used our EFAP program before. It's been fantastic for me in my career. I've used it a couple of times, and it's always been a wonderful thing to have, and it's good to know it's there. Although I imagine, to Ray's point, I imagine that they're facing a lot of demand right now. Keith, what's your take on the mental health conversation and how that may have changed or evolved over COVID?
A lot of what Ryan and Ray said. Again, communication has been, important in the amount of times that we touch base with everybody. We had started the mental health conversation in our company a few years ago, so it has evolved and was starting to evolve already. But what I see from COVID is that people are actually remembering some of the things that we talked about before, and people are actually, when you used to meet somebody and say, "How you doing?" It's got a whole new context now, right? And I find our guys are asking that, whereas, how's it going? How you doing? And it's not just conversation anymore. They actually are trying to help you out, right? And I like to think that came from, we've been talking about it for a long time, or for a couple of years at least, and now they see that there's some value in that. And the other thing is it's allowed people to put their guard down a little bit in what can be a fairly macho world of construction. It's okay to tell somebody you're not doing okay, or you need help. And I think this is pushed it along. I pushed it, made it better, because people feel more comfortable to say, "Yeah, I'm not having a great day," or, I need to go home, or whatever. So yeah, that's what I see.
Yeah, thanks, Keith. So Dana, you started off this conversation by talking about mental health and the challenge for that with your team. How are you managing through it, and what are you doing to provide those kinds of supports, and what are the main things you're hearing or seeing?
Well, we've been doing a lot of things that Keith, Ryan, Ray have been doing. SCSA, we followed along that line. A few years ago, we had some of our safety personnel trained with mental health awareness and how to spot. We've turned it down to our foremen. So we've got the technical, the educational side of things. My office has always been an open door policy. If you ever had a family issue, a social issue, health issue, my door was always open. So guys they're still phoning me saying, Dana, am I going to have a job in a week? Because we've shut down some sites and scaled back so we could meet the requirements and stuff like that. So a lot of it comes down for my young group anyway, my core group, is more the financial side of things, because I have one that just bought a house and she's terrified that the jobs are coming to an end and she cannot make her next house payment. And we have a young family with health issues. So, okay, you stay at home, we'll work from home, we'll get you everything you need. So we've loaded up his house and stuff like that. One of our guys had to leave because his wife was in healthcare. So it was no problem. It's just go ahead, you leave, you come back when you're ready. Because he didn't want to bring anything back to the job site. So, yeah, okay, it's not a problem there. But when it come down to it in the end, it was just more the financial situation that some of my younger, newer construction employees just getting into the construction field, they bought houses and trucks and boats and all that. Now they're going to have a hard time making the payments on that for the next month or two. And I think that's a lot of the situation where it's coming down to with the mental health within my group anyway. And then the social aspect of not being able to sit out in the backyard with your neighbor and stuff like that.
Yeah.
Yeah.
Okay. Actually, we're running low on time, and I have so many questions I want to ask. But I'm going to try. So I'm going to try one that I'm going to ask to be a rapid fire question. So I'm going to ask you to. What I'm going to ask is, I was thinking about what Dana was saying there and what I've heard from all of you about helping your folks cope. And part of that extra pressure on managers is meaning you have to cope, right? Because you have to cope not only with all of your stuff, but also with all of your people's stuff. And I'm just wondering if you can suggest one strategy that you have used to help you cope in this time of uncertainty as a leader. And Ryan, maybe we'll start with you. And it can be whatever strategy works for you. I hope you'd be willing to share.
Take some time off if you need it. Simple as that. I'm on days off right now, to be honest with you.
Oh, thank you for joining us. I'm sorry.
Oh, no problem. You got to take the time when you need it. It's simple as that. Our mental health is just important for everybody out there. So, if you need the time, you need the space, take it.
Yeah. Ray?
I would say, you guys, one of the things about safety is it's a little bit like running into a Doberman in a dark alley. The reward for safety, the best outcome, is nothing. Nothing happens, and that's difficult. It really is. But at the end of the day, we should come out of this stronger than we were before. If you, and I think I talked about this at the other meeting we were on, Carrie, if you look at our regulations, it talks about providing clean water. It talks about providing washrooms, clean washrooms for the guys. It talks about means of them being able to wash their hands, those sorts of things. Those are all related to hepatitis, and they are related to influenza. And those will improve your sick leave stats. Those will improve your productivity, as well as protecting against the myriad of other things like hantavirus, if you're working on a site where there might be deer mice or other rodents. So there are advantages to this. We've always had a problem selling it to the workers, selling it to the rank and file. We can do online training, we can do all sorts of training, but it comes down the people that you manage. There's a very strong practical element. They have to do the work, and that involves getting out on these sites and doing it. And you have an opportunity here to get these guys to buy into this, and it will pay dividends down the road. I know it seems awful now, but we're going to go through this probably again. And this next time, hopefully, we'll be ready.
So let me ask you, Ray, that's fantastic stuff. And I want to circle back to a funny story to build off what you said. But what's one thing that you're doing now to help keep yourself even keeled through all of this?
I would say, it's going to sound stupid, I take naps.
Good for you.
Like what I do is I try and make it, I try and be a bit of a clock watcher. I start work at 7:30. I go through, and at 5 o'clock, I shut the computer off and I go lay down for a half an hour, 40 minutes and reboot.
That's awesome.
And kind of go into the family mood or whatever you want to call it. And that's how I've been dealing with it since I've been back here. It's buggered up my sleep a little bit, but it seems to work. It seems to work for me anyway.
Good. Thank you for sharing. Loy.
Well, I actually took yesterday off. I felt myself hitting a brick wall, and I took my day, and I took all my frustrations out on the weeds in my backyard.
Yeah. That's good. And did you get them all?
Not even close. So I have room for more. That's my stress relief is get outside, turn on some music, and get some fresh air and exercise.
Oh, that's awesome. Thank you. Dana.
Staying active, playing with our new puppies that we got in January.
What kind of puppies?
Playing with the kids, but basically staying active, trying to keep my mind busy doing other things than thinking of pandemics or, spending too much money when we don't have a whole lot of money coming in, and that's what it was, just keeping my mind busy.
Yeah, that's good. Keith, what about you?
Well, I've always been fairly pragmatic, and I found at the start of the pandemic that the amount of information and the stuff that was coming at you every day was stressful, and it took me a while to finally realize that there's really not much you can do about the spread of it other than what you can do yourself. There's not much you can do about the business situation right now other than what you can do yourself. So I just got away from worrying about it in a big picture, I guess, and kind of sounds like a manual or something, but just take it day to day, and don't worry about don't worry about necessarily the big picture, because there's not a lot we can do right now about the big picture.
Yeah.
If you start worrying about how Canadians are going to pay for this deficit and things like that, it could really explode. So and when I get like that, I'm a really poor guitar player, so I've had lots of time to sit and play my guitar and reflect on a little Bob Dylan or John Prine, and that seems to
that's awesome.
That seems to help.
I'm looking forward to a future Zoom call where you can serenade us all. I look forward to that.
You want your plugs.
Okay, so last question. I hope everybody has a couple of minutes to stick around, and we'll get off here real quick. We'll start with you, Ray. This is about the future. You talked a little bit about some of the positives that might come out of this in terms of the behaviors and how these behaviors might protect us from other potential diseases. But there's a good chance we're going to be dealing with some kind of protection around COVID, some kind of new normal for, I would say, 2 years is not out of the realm of possibility, and maybe longer, but let's use 2 years as the time frame. What do you see as some of the lasting impacts of this, Ray, and what are the things we need to be mindful of, realizing that this is not going to be gone by September?
I think it's a little bit like watching where you are and what you're doing. I think social distancing is going to be here for quite a while. I think one of the comments, I think it was by a reeve or a mayor of one of the northern communities, was that there should be more municipal control, that when you have an outbreak in a place like OH, that's shut down. But it doesn't really affect the rest of the province that might be doing quite well. that's difficult to enforce, as we're finding out up north. But, you know, I mean, in terms of economics for the province, in terms of economics for individual businesses and individuals in those cities, that's quite important. So it speaks to how we handle this in the future. As you can tell, one of the biggest problems about this is going to be travel, and where you travel and how you travel. And I think we're going to be stuck with that for about 2 years. And it may be the cause of the second wave, I'm afraid.
So Loy, thank you, Ray. Loy, how do we prepare ourselves for the longer term here, and what does that mean?
Well, I think we've already started, but it's going to be enhanced. I think one of the positives, if you will, is that people have no choice but to make group safety on their job sites. So if they were resistant to it before, they have no choice in that right now. So that will hopefully branch off into recognizing the other hazards on site as well. So this is the start of something that could potentially be very good. I agree that I think social distancing is going to be a thing for a very long time. Ongoing distance learning, more video chats, that sort of thing. I think a lot of business is going to continue in the manner that we've transitioned to for quite some time beyond the pandemic.
Thanks, Loy, and I think you're right that there are some, you know, the idea of the evolution of the safety culture in construction could be a positive outcome of this for sure. Okay, we're going to go Dana, Keith, and then Ryan for the last word. So Dana, your thoughts in terms of the long term and how we prepare for something that's not going to go away tomorrow?
I'm not really too sure how you're going to prepare for this ongoing for the next 4 or 5 months, but things are changing every day. Technology is going to be the new wave coming through the construction field, I think. Like I said before, you're going to see a lot of these video conference meetings instead of one-on-ones, where a lot of companies are going to cut down on the traveling from here to go see the guys out in New Jersey for the job meeting. It's going to be a lot more video presentations. And then when you get to the job sites, it's going to be new schedules. Instead of working a full day shift crew of 20 guys, it might be a day shift, 10 on days and 10 on nights scenario, or working different patterns of 6 and 1s and 10 and 4s and stuff like that to try and minimize those crews down as much as possible. I think a lot of the other industries are going to try to slowly break out projects and spread them out a little bit more for some of the bigger major job sites. Instead of running all the capital projects at once, they might spread them out through the year to minimize the effect of any pandemic that may come to the job site. But technology is going to be definitely the big one, I think. You're going to see a lot of change. A lot more one-on-one video conferencing from the office to the job sites. And I know we've already started setting that up with big screen TV sitting on the job site, so you can see schedules back and forth. And yeah, and I think that's what you're going to see is a technology change.
Yeah, we're going to find ways to adapt, right?
Yeah, and then the manpower on site they'll be adapting to the new procedures on a daily basis.
Okay, thanks, Dana. Keith?
Yeah.
A lot of what Dana and Loy had to say, exactly, I agree. One of the things to build a bit from Loy, one of the positives I see is the whole mental health conversation. I think it's going to gain more traction. You know, it was gaining traction, and it's now, as we were talking about before, it's okay to ask somebody how you doing, and people are more comfortable with that whole mental health aspect of health and job site safety. So I think that's one of the positives we're going to see come out of this is just more awareness of your fellow worker, your employee, and more awareness around mental health.
Yeah. think that's true. Thanks, Keith. So Ryan, the last word goes to you in terms of sort of how we prepare for the longer term and what the long-term implications might be.
Well, I think one of the things that this has taught us is we're pretty adaptable when we got to change how we do things very, very quickly. And, you know, attitudes have changed a lot. I think that's what's going to support dealing with it in the future. You know, sanitization, hand washing, you know, even the attitudes and behaviors, and a lot of it, especially with safety, a lot of it's culture and attitude. And having people understand, you know, it used to be, you know, I knew people that would come in, I haven't had a sick day in 4 years, but you've been sick a bunch of times. And now, you know, that changing in attitude where if you're sick, don't come in, stay home, and you know, adapt your behavior, wash your hands, coming on site. Even, you know, you're seeing it everywhere now, walking into buildings, having hand sanitizer available all the time, or hand washing stations. And I think, how are we going to deal with it in the future? We've made some significant adaptations and changes in our behaviors. And I think those positive changes are going to continue forward. And that's going to be the key to help reduce the spread. You know, people are a lot more conscious of it now and understand that it's not about them, it's about everybody else. And so, you know, adapt as necessary.
Yeah, that's an interesting observation. Yeah. Okay. Well, and I think you're right. I mean, you know, that we may end up having some of the long-term positive health benefits of being this kind of health conscious and focused on prevention. So thank you, everybody. I really appreciate your time. Thank you so much for making time, especially on a Friday before a long weekend. I'm grateful that you were able to do that and committed to doing that. So thank you. As I said, the next step is going to be Megan taking all of this content and putting it into an article, sort of covering some of the themes we discussed, which we will share with you for your feedback and insights. We may circle back and have a conversation about whether we will publish this discussion online, but before we would do that, we would get your permission. I just want to close with a funny story that a couple of you have heard me tell before, but it made me think of it because a few of you talked about how behaviors have had to change. And during our first safety town hall that we did, Loy would remember this, she was a panelist for it, and Ryan was too. We had a question from somebody, a legitimate question, I think, that said, okay, let me understand this. So I have to wash my hands before and after I go pee. And I thought, oh, we're definitely facing a change in culture, aren't we? But I think that's going to be a good thing. So there may be good things that come out of this in the end. So thanks, everybody.